The first question we were asked to respond to was, your expert examination reveals that you have fractured your fibula. Your physician remarks, well, it's better than your tibia. And the reason is because your tibia supports way more weight than your fibula. And there's not a lot of soft tissue that surrounds that bone. So if it breaks, it becomes an open fracture and is more likely to get an infection, which is very dangerous. Now, the second question we were asked to answer is, an individual with very low levels of vitamin D presents themselves to you complaining of seemingly fragile bones. Explain how these might be connected. Well, vitamin D, is, as we all know, is very essential for normal absorption of calcium. And phosphorasis, I think I said that wrong, but I tried my best, which is needed to keep our bones healthy. And when you have low vitamin levels, then your bones become way more fragile. And the last question was, during the early years of space exploration, our astronauts who have been floating in space would return to Earth showing significant bone loss dependent on how long they were in space. Discuss how this might happen and what could be done to alleviate this condition. Well, while astronauts are floating in space, they're not really exerting enough pressure on their bones because, they're weightless, so there's not a lot. So therefore, without force of gravity or exerting that pressure on the bones, is causing mechanical stress on their bones, which is ultimately resulting in bone mass loss, which is pretty serious. So to alleviate this condition, astronauts now do restrictive exercise that's designated to help put pressure on the bones and keep their bones healthy and strong and keep them healthy as well.